This week on Empowering Midlife Wellness, I'm talking about vitamin D. So much controversy about it right now. You might have read in June that the Endocrine Society suggested that we don't need to take it, we don't need to draw our blood. Study in 2022 suggested that vitamin D is more or less useless. Well, not quite. Let's not throw the baby out with the bathwater just yet. I'm going to get into what all these studies show and what I suggest that we do with vitamin D in the meantime, while we're still figuring this out. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated just to serving women in midlife, women like me who want to feel great now and also set up the healthiest elder version of ourselves, because of course that starts right now. So you might have been watching the news like me and been hearing all kinds of controversy about vitamin D lately, and this is such an interesting topic. I've actually been spending days researching this, both sides, because you'll find there are parties who say that vitamin D does absolutely nothing. In fact, there was a big study that was reported in June that said pretty much that vitamin D had no effect on bone health, heart health, cancer, all-cause death, all the things that we have traditionally associated with vitamin D. So that was very curious. And then on the other side, there's a big party who are absolutely certain that taking vitamin D supplements do help with all those things. So where is the truth? And as usual, it's probably somewhere in the middle. But in order to really get down to what it is that we think is the most sensible thing to do about vitamin D, we've really got to look at some studies and study design and understand how these studies were put together and not just swallow the headlines hook, line, and sinker. Sometimes that gets us in trouble, as we know happened with the Women's Health Initiative. So I think this recent report in June from the Endocrine Society suggesting that vitamin D is worthless, with a few exceptions, is kind of in that bucket. I think it's missing a few things, but I also think there is some valuable information there. So let's just look into that and see if we can come up with some sensible approaches to whether we're going to measure vitamin D, whether we're going to take a supplement or just get it in nature from sunlight and food. So just backing up, what is vitamin D? This actually operates as a hormone. It's very interesting. So vitamin D is actually synthesized in our skin. UVB light hits our skin. It's synthesized into a precursor, vitamin D3, and then it goes through two different transfer processes, one in our liver and the second one in our kidneys. What you get on a blood test if you get your blood work done is 25 hydroxy vitamin D3, and that's the majority of what's floating around in our system. That's the metabolite that's made in our liver, and then it's made into the active metabolite in our kidneys. And who cares about that? But it's good to know what's being measured, right? So this is made in our own body, does require UVB rays, and we can also get it in food. You know, the food sources are not particularly prevalent. Oily fish, cod liver oil was the first discovery that cured rickets, which is the end point of severe vitamin D deficiency. Now that became really prevalent in the Industrial Revolution when children were living under blankets of smoke. No sun was coming through and they were stuck in a factory. So there was an interesting history that during that time, rickets, which is a severe bony deformity, was developing much more commonly in those cities and areas where children were being kept in the dark. Then research was done that put two and two together, and we developed this understanding that vitamin D is the sunshine vitamin that requires sunshine. And I can't remember his name, but someone won a Nobel Prize for discovering that. So it's had a really interesting history. So for sure, we know that severe deficiency of vitamin D is terrible. And nobody is arguing that vitamin D is not vital. It's a vitamin. But the question is whether we need to take a supplement. So that's where the arguments lie. Now let's get into the controversy about how much do we need? Should we check blood levels? What levels are we looking for? Well, it had an interesting history, and just keep in mind, all of these guidelines are established by humans. right? So being humans have opinions, humans make mistakes, humans learn as we go. So it's normal, and thank goodness that we are learning that sometimes things change, right? So in 2010, the Institute of Medicine came up with a number of 20. Now, vitamin D is measured in nanograms per milliliter. So 20 was established as the lower limit below which we would consider one to have deficiency. So there's all these words: deficient, insufficient, sufficient, and then maybe optimal, right? But below 20 was agreed by the Institute of Medicine to be too low. Actually, some other people did studies suggesting that we don't really get into trouble till it's even lower than that, like maybe 10 or 12. But let's just say 20 was established as the lower limit. Below that, we would be deficient. Again, these are made up terms, so let's just keep our minds open. A year later, in 2011, a different group, the Endocrine Society, set a different level, lower limit of 30. Now, the reason that they did that is complicated, but 20 was considered too low, 30 was considered to be the lower limit. Now, if you look at most lab tests, the Endocrine Society's recommendation at that time in 2011 is what you're going to see on your lab test. So the reference range that you will see when you get your blood drawn for 25-hydroxy vitamin D3, which is what you get drawn, is going to say in most labs 30 to 100. Well, that's a big range, right? And just keep in mind that was made up. Now, 100, what happens if it's higher than that? Well, actually, a lot of people have levels higher than that just walking around. For example, studies done on lifeguards who are in the sun all day long frequently have naturally occurring levels that are much higher than 100, and they're just fine. But generally, studies have shown that beyond 100, we don't get any additional benefit. Okay, so that makes sense. Really low, like 10, 15, certainly well below 30, we can develop bone loss or rickets. Don't want that. And then super high, if it's really high and nobody knows quite how high, we can actually get too much calcium in our system. We can get kidney stones, we can get calcifications in our heart and other places. So yes, we don't want it too high or too low. Everybody agrees on that. But there's so much disagreement on the in-between. So here we are. So over the years, and this really started speeding up in around 2020, hundreds, literally hundreds, you could not count exactly how many studies have been done on vitamin D, and with few exceptions. Now, there's no agreement, no studies have all turned out exactly the same, but with a lot of agreement, vitamin D has been shown to be beneficial for all kinds of things. Now, keep in mind, there's no standardization of the dose that's given to people in these studies, most of them. There's no standardization of the baseline disease that these people have in most studies. There's no standardization of how much vitamin D they're getting from other places. So this is where it gets really interesting. However, in the lab, like in a petri dish in the lab on the bench with a scientist, or in animals, vitamin D has been shown to have a bunch of undeniable effects all over our body. Remember, it acts as a hormone. It enters the nucleus of our cells and it turns off or turns on different pathways that do all kinds of things. Now, we think about it most in the context of bone health, and I'll talk to you about that, but the other huge things, it's anti-inflammatory properties, also immune supporting properties, and as a result of those two things, helps all kinds of stuff. So if you have a better immune system and lower inflammation, goes to reason that you would develop fewer cancers, you would get less infection, you would have less autoimmune disease, and studies have shown reduction in all of those things. So there are people who would tell you that vitamin D would treat just about everything in the world, and you should just take tons of it. And that probably isn't quite accurate. And then there are people who would say that it's absolutely useless and doesn't do anything, and that is probably not accurate either. So what are we going to believe? Well, let's talk again about the type of studies that are out there. And I've talked about this before, but just broadly, most of the studies on anything to do with a supplement or nutrition are what are called observational studies, where you look back in time at a group of people and you ask them what they did, or you look at data from various different sources about what they did or what they took, and then you see what happened and you try to draw conclusions from that. But you cannot ever say that causation exists based on what you find in an observational study. So in hundreds of observational studies, vitamin D has been associated with reduction in all the diseases I just mentioned. So you can't say it's causative, and a big criticism is, well, like I said, well, all of these people were just healthier. And so they got less cancer, less diabetes, less heart disease, less autoimmune disease, less everything, because they were just healthier. They were outside more, they were exercising more, they're taking vitamin D, so they're wealthier, they're getting better medical care. And yeah, there is a lot of that, and that's called the healthy user bias. So it shows up all the time in nutritional research and in supplement research. So it's very hard to figure out what's what. Now, the next level of studies that are generally considered to be more reliable are what are called clinical trials or randomized controlled trials. So this is done looking forward. You design a study and you say, okay, I'm going to give vitamin D to this group and I'm not going to give it to this other group, and neither party is going to know what they're taking, because it's important that everybody's blinded to what they're taking so that they're not biased. And then off they go and they take it, and then some endpoints are measured. And that would be more reliable because you're somewhat controlling what each group is getting, right? So randomized controlled trials are the standard for what we hold as more valid, but they can also be wrong because here's an example, especially with things like food and vitamins. So if you're giving vitamin D to one group of people and not to another one, you got to know how much vitamin D the placebo group is getting from other places. Like, are they getting more sunlight? Do they have darker skin or lighter skin? Are they eating more fish and cod liver oil? There's a whole bunch of stuff going on that you need to take into account. Same with the other group. It's a little different than doing a drug trial, right? So if you think about doing a randomized controlled trial with a drug, let's just say a statin, right? So you're giving a group a statin and another group isn't getting a statin, and the control group has no statin in their blood, right? They're not getting it anywhere else. With vitamin D, it's different. Both groups have vitamin D in their system, and most of these studies never check their blood level at the beginning. So a lot of the people in the control group in these vitamin studies had a bunch of vitamin D in their system as well. And so you're sort of measuring two different groups who are getting vitamin D. One might be getting a little bit more than the other. One's getting it naturally, the other one's getting some more with a supplement. Often they're not even measuring blood levels, so it can sound impressive when you do a randomized controlled trial. There was a very famous one in 2022 called VITAL, the VITAL study. Some people say put the whole question of vitamin D to rest. Some people say that just ended it, it nailed the coffin on vitamin D. Vitamin D is useless. The VITAL trial proved it. Not really. So the VITAL trial was a very amazing study, a very impressive study with about 25,000 people. It followed them for 5 years. But there were some problems that ones like I was talking about. It was an older population, so that's great, because if you're looking for stuff like fracture, heart disease, stroke, cancer, you want to look at a population that's possibly going to get that. So the average age patient in that study was 67. They were about half and half men and female, so it was pretty well designed. So they gave 2,000 international units of vitamin D to the treatment arm. In the control arm, the people who were not supposed to be getting any vitamin D, they got a placebo that looked like vitamin D, but they were told they were able to continue taking 800 international units of vitamin D and not stop that. So you've got one group that's taking 800, or some of them were not taking any, but they were allowed to take up to 800. Who knows how much sun they were getting? Who knows how much fish and cod liver oil and other vitamin D containing foods they were getting. And then this other group was getting a little bit more, 2,000. Similarly, no control for the sunlight and all the other things. So it kind of was not surprising that they didn't show much difference at the end. In fact, they didn't show any difference after 5 years in any of the major endpoints, like heart disease, cancer. Those were the two things they were really looking for. Everybody was surprised, like, what do you mean there's no difference in heart disease and cancer? There must be. Well, you can kind of see why there wouldn't be, because they were both getting vitamin D. The reason that they gave, this is where it gets really entertaining, the reason they gave 800 international units to the control group is because it would have been unethical not to give them any, because it's so well accepted that vitamin D is necessary. So they couldn't give the control group nothing. That would have not been allowed. So really not surprising that they didn't show a difference in that study, but it was reported as if that just sealed the deal on vitamin D. And if you didn't read the details, it sounded impressive. They followed these two groups. The one that took vitamin D had no difference than the one that didn't. No, much more to it than that. They also selected a healthy population. This was an older population, but they were healthy people. They were not selected to be at risk for any of those diseases, and they weren't selected based on having low blood levels of vitamin D. And so it didn't answer the question at all. Does taking vitamin D when your vitamin D is low reduce the risk of those things? And that's the question I want to know, because I'm not going to give you vitamin D if your vitamin D level's optimal. And a bunch of people in that study came in with optimal vitamin D. So I love this analogy. I've heard another speaker say this. If you did a study on aspirin and you gave it to a bunch of people who did not have a headache, everybody would feel the same at the end, right? Because you were testing a bunch of people who did not have the problem that the drug would cure. So there's a lot of things wrong with that. It was a beautiful, very important study, but it wasn't run for long enough, and it wasn't done with a high enough dose of vitamin D, because 2,000 international units is a lot less than many of us traditionally recommend. And then they also didn't follow blood levels. And so there's just a lot of pieces missing from that. It was a great study, but absolutely I would not in any way say that the VITAL study put nails in the coffin for vitamin D. Not at all. It just showed that, yeah, if you give some vitamin D and a bit more, that doesn't make a difference. But a better question might be, let's look at giving higher doses of vitamin D, getting to what we consider to be optimal level of vitamin D, which might be, say, 40 to 60, and see if that makes a difference. So that'll be a great study when somebody does it. And then start with people who are beginning with low vitamin D, because if they're already at 40 to 60, the study's not going to show any difference, right? So we need to understand how studies work and not just read the headline in the newspaper. So the VITAL study, as I mentioned, yes, it showed there was no difference. The headline said there's no protection for bone. That was not a primary thing they were looking for, but they took a subgroup and they did not see an improvement in fracture. So that was surprising until you read the fine print. Of course you didn't. They were both getting vitamin D. And they didn't start out with low vitamin D. All those other things, right? So let's put that over here. So that's not the only study that has shown no difference. There have been others that have shown no difference. You could argue similar things about those, primarily because, again, everybody's getting some vitamin D. We're all getting some sun. Some are getting more than others. Some are eating more than others in their food. Some are not deficient in the first place. So unless you weed that out in the beginning, it's quite easy to see why you're not going to see a difference in a randomized controlled trial, unless you did something really different, like the control group is not allowed to take any vitamin D. Well, that's unethical, so they can't do that. That means the treatment arm would have to take a higher dose, a safe higher dose, but something like 4,000 international units, which is what the FDA considers to be the upper level of what's safe to take daily. So that might show a difference, right, if you gave a group 4,000 unit and the other one 800. But you can just understand why this is not black and white. Okay, so we've got all these observational studies, hundreds of them, showing that vitamin D helps for all the diseases that I mentioned. And so we, as a medical community, have really believed that, and I personally take vitamin D, and I've been prescribing it to my patients based on the Endocrine Society's suggestion that 30 is the lower limit of what's safe, and also looking at some studies suggesting that 50 or 60 might be better. There are some studies suggesting that higher levels have a more beneficial effect for things like immune help, and that would reduce infection. It in fact does. There's massive amounts of data showing that People who are low in vitamin D have a much harder time with COVID, much more likely to be hospitalized, much more likely to die, more likely to develop long COVID. So at levels less than, depending on the study, 20 or 30, much higher risk of those things than patients with higher levels. So there is a lot of data out there that has supported the idea in the medical community that we want to keep our levels, 40 to 60, something like that, probably less than 100 just because there's no benefit there. And that's what I'm still doing, and I'm taking vitamin D to reach that level myself, and I'm recommending that from my patients because it's safe. And it's safe to be at 40 to 60. And we don't really know about the other stuff because these studies are inconsistent. Well, the Endocrine Society, as a great organization, went on this mission to try to answer this question. Good on them. So they did what's called a systemic review, which is a massive high-level review of every single thing they could find that had ever been written about vitamin D, and looked at, I think, over 150 studies since the 1940s, and weeded out the ones that were worth their weight, and then put them all through this massive statistical computer to try to see if there was any difference. Well, these systemic reviews or high-level studies, there are studies called a meta-analysis that look at lots of other smaller studies, and this is even looking at lots of meta-analyses. So it's kind of looking at all of the studies, some observational, some randomized controlled trials, some meta-analysis, all of them, and shove all of that into one bucket and try to figure out what's what. Well, this is a great idea, an amazing project, and frequently comes up with some really interesting data, but we have to also remember the old adage that when you put junk in, junk comes out. So if you're looking at a whole bunch of studies that are not very good, then the data that you're going to derive by putting them all together is also not going to be very good. So one of the problems was, there's a bunch of observational studies that arguably have a bunch of healthy user bias and other types of bias, and then there's some randomized controlled trials. So those studies have all the problems that I mentioned because neither group is not getting vitamin D, and so that can muddy those waters. So in a certain way, after looking at all of these papers, I'm thinking that in this particular case, the observational studies have a lot of value. Because there's just so many of them. And so the preponderance of the evidence suggests that vitamin D is helpful, and there's zero evidence that it's harmful. So sometimes when we don't know the answer yet, I think just throwing it away is probably not wise. And we did that, remember, with the Women's Health Initiative study, and look where that got us. So I think we just have to sort of hold our horses here and be a little bit sensible. We know it's good for a lot of things. We don't know exactly how many studies have been inconclusive, but having levels at 40 to 60 has been shown in many studies to be beneficial, more so than even 20 to 30. Yeah, there's conflicting data, but just saying that it's not worth taking, I think that's going to get us in trouble. So don't go there. And in fact, the Endocrine Society's recommendations that I'm going to talk a little bit about more in a moment did not say not to take any. They were just advising taking more than the RDA, which is 600 or 800 international units as we get older, but small amounts. So they're not saying don't take it. They're not saying it's not important. They're just suggesting that based on their review of all of these studies, there is no benefit in taking more than the RDA, which is not agreed upon in any form or fashion by everybody because 800 international units is a really small amount. Of course, it depends on how much you're getting from other sources. You might not need any. Now, how would you know? Well, you'd need to draw your blood, right? And so another super interesting, and I don't know why they say these things, but the Endocrine Society has decided that there's no benefit in drawing blood, that we shouldn't screen for vitamin D. And I just find that so confusing. First of all, they're admitting that vitamin D is vital. They're also admitting that having deficient vitamin D is terrible, but you're not supposed to check it. So how would you possibly know if you need a supplement or not? So their suggestion is either go outside in the sun, which is great advice, or eat some fish, which is also great advice, or just take the RDA, but don't check. And I get where these academic institutions come from with this kind of culture around not checking stuff. I mean, a lot of it's driven by economics. It's not free to get your blood drawn and check vitamin D, but it's really inexpensive. Yeah, if you have no resources, sure, just take a supplement and go outside in the sun and eat some fish. But we have resources, and data is useful. So if I checked your vitamin D and it was 50, you wouldn't have to take anything. So nobody is suggesting, or they shouldn't be, in my opinion, that everybody needs to take a supplement. If you're a lifeguard or you're out playing tennis every day or you eat lots of cod liver oil, very likely you don't need to take it if you live in a latitude that gets sun most of the year. Now, if you are and otherwise not in that group, if you sit inside all day, wear sunscreen when you're outside, live in a latitude that's not sunny most of the year, and you don't eat a lot in your diet, very likely you're going to be below, make up a number, 20, 30, whatever certain institutions think is too low. So why don't we check it? The other reason to check it is because it can get too high. If you're taking a supplement willy-nilly without anybody monitoring it, it could get too high. And you could end up in that group that develops calcifications in places that we don't want. Because remember, one of the primary ways that vitamin D works is by helping to draw calcium and phosphorus out of our gut so we can use it in the many places that we need it, including in our bone. So if we get too much calcium out of our gut, because our vitamin D is too high, then we start sticking calcium in places that we don't want. Again, kidney stones, calcifications in the heart, stuff like that. So I would want to check it. I don't want to be too high or too low. You know, in the dark ages, we didn't have a lab and we just had to guess, but why on earth would the Endocrine Society recommend not checking this very inexpensive lab when we know that deficient levels are associated with critical illnesses? And we also have a lot of evidence to say that higher levels are beneficial. Now, they even accept this. There's certain groups that they found in their giant systemic review that benefited from higher levels, including people over 75. Well, that's great, but I don't want to wait to be 75 to find out that I need vitamin D to reduce my risk of all-cause mortality and other things, right? So the idea of taking it makes sense to me if you need it. And I think, you know, whatever level that we pick as being the cutoff, let's pick one. 20, 30, those are quite similar. That's too low. 40 to 60 is safe, and that's giving us a little bit of a cushion while we're trying to figure this out, because there are going to be a lot more studies done on this. There should be studies done like the one I suggested, giving a higher dose of vitamin D for a longer time to a group of people who had been documented at their baseline to have low vitamin D, and then compare them to a different group. Of course, you can't not give them vitamin D because that would be unethical. Everybody knows that you need it. But we need to make the difference between the two groups a little bit wider, because right now they're kind of both similar. Anyway, so maybe someone will do that study, or unfortunately, this happened with the Women's Health Initiative too. Like when something comes out that a big society says, okay, we're just going to stop doing it and it's bad, the funding runs out for doing more studies. So it's, going to be tricky to do another big study for a little while perhaps. So we kind of have to use our common sense. Okay, so I am not going to stop drawing blood for vitamin D in my office, as the Endocrine Society suggests, because of the reasons that I told you. I don't think we should take vitamin D unless we've documented that it's low, maybe less than 40. And I also think we should check and make sure it's not too high. So checking it annually is what I'll continue to do right now. And if somebody comes in with very low vitamin D, we'll check it in a few months. Now, it does take a few months for vitamin D to get to its steady state because it's stored mostly in our fat, so you don't want to check it a week later, but for sure. Also, lifestyle changes are really important. So get out in the sun if you live in a place where there's sun. Now, most of us wear sunscreen. That does block most of the vitamin D production, but low-angle sunlight in the early evening or early morning when the UVB light is quite safe for our skin. Even someone like me does not get sunburn in the first couple of hours after sunrise or the last couple. And then eat some oily fish. Why not? That's a great thing to do. Knowing how important vitamin D is, of course, the government added it as a supplement to milk, cereal, lots of other things. I don't know, I'm not big on getting my supplements in government-approved ways, and that's usually vitamin D2 anyway. So but you would get it that way. But check and see how much you're getting, because you might be getting tons, and then you don't need this supplement. Anyway, so I think that I'm not going to stop checking, and I'm also going to stick with the idea that right now my goal to be optimal is somewhere in the 40 to 60 range, because there are a lot of studies suggesting that. Now, what are some of the most important ones? I mentioned the COVID thing, and that's huge. Now, many of us have stopped being worried about COVID, but COVID is one virus, right? Other viruses are going to follow a similar pattern. Basically, what we found with COVID is people with very low vitamin D levels did worse. And so that also applies to other respiratory infections, respiratory cancers even. So anything that we need an immune system for, and COVID was just a great example that was handed to us on a plate. A great way to study it because we were bombarded with it so quickly. That was a very easy thing to study. But anything that requires our immune system is helped by vitamin D, and we know this. It's been studied in the lab for years. So we definitely don't want it to be too low because it's immune compromising. It's also, as I mentioned, it's an anti-inflammatory, and so that's vital for reducing lots of diseases. One of the things that's come up over and over again is that low vitamin D increases the risk of diabetes. And actually in this Endocrine Society review that was published in June, they did indicate that one of the only positive findings that they could come up with was that in pre-diabetic patients, if they took vitamin D, they had a lower incidence of progressing to diabetes. So it absolutely has an effect on insulin sensitivity. That's been shown in multiple studies. That's not the only thing it does, but that we know that it does it in that way. And so if it helps with insulin sensitivity, and if it helps with COVID, and that was recognized even in this big review, there's no way it doesn't help with other things, because those are not isolated pathways. Those are examples of the anti-inflammatory properties and the immune protecting properties that vitamin D has. So it just makes sense that there are others, and again, they have been shown in hundreds of observational studies. Granted, there's lots of good reasons to criticize observational studies. Let me tell you a common one. So with the Diabetes Association, meaning the association between taking vitamin D and having a lower incidence of diabetes, you could argue that that's because these patients are just less healthy. They don't go outside. Like I said, they don't eat healthy food, they don't exercise, and they also don't take vitamin D. And so a prescription for that patient might be, you don't need to take vitamin D, you just need to go for a walk outside and get some exercise and eat healthy food. And I'm sure that's part of it, undeniably. But again, so many studies putting those two things together. I think it's very hard to not believe that having low vitamin D increases our risk of diabetes. In other words, it lowers our sensitivity to insulin, and we want to be insulin sensitive. That's the opposite of insulin resistant. So insulin sensitivity is good. That's a good thing. Okay, so what's my summary here? Do we need to take vitamin D? Not necessarily. The only way we know is by drawing your blood. So do we need to stop drawing blood for vitamin D? Absolutely not, because how in the heck otherwise would we know? Now, if we were doing a bone marrow biopsy or something difficult, yeah, that would be something I would certainly question, but this is easy as part of your routine annual blood work. So please get your vitamin D checked, and it should be 25-hydroxy vitamin D3 that's being checked, and generally it is. And then based on that number, I would see, do you need to take a supplement or not, with the goal of keeping it in that, say, 40 to 60 range. And I am making that up, and I reserve the right to change my mind about those numbers because it's been shown to be safe, and in many, granted, not perfect studies, that's been shown to be a number that's reduced the risk of a bunch of diseases. Higher than that, very few studies show any benefit. So 40 to 60-ish, less than 100. In the meantime, while we're figuring this out, please don't stop taking it because, all these problems can occur. And remember, it was reported so badly. Again, I'm saying this is a lot like the Women's Health Initiative study where it just was like, stop taking estrogen because it causes cancer. The vitamin D study was reported kind of like that, like vitamin D is useless, stop taking it. No, that's not even what they said. In fact, in the study, they recognized a lot of potential problems with the study. They also were, again, saying, we need vitamin D. The question is, do we need more than the recommended daily amount? Because 800 international units, nobody's arguing against that. In fact, nobody is arguing that we don't need that much. The question is, do we need 4,000 international units, which is what I take? Possibly, but the only way to know is to draw your blood. So that's what I have to say about vitamin D. I hope it was more clarifying than confusing. It's such a confusing topic, but do not believe the headlines in the newspaper. That's, again, what I'm going to reiterate, even if it sounds so impressive. And it sure did. Endocrine Society reviewed 150 papers and found that vitamin D did just about nothing, and so don't bother checking it. Yeah, you got to read a little finer print than that. That's not exactly what they said. So let's get smart, ladies. Let's look below the surface. Let's ask some more questions, and don't throw the baby out with the bathwater, because absolutely 100% we need vitamin D to live. We don't all need to take a supplement, absolutely, because we can get it from nature, but we're not all getting it from nature. So let's just draw our blood, see what it is, stick with a sensible level, don't do anything too crazy, high or low, while this data is continued to be looked into. Because remember, vitamin D wasn't even discovered till 100 years ago, and studies on it really haven't been accelerating since the past 20 years or so. So there's much, much more to learn. So we want to stay safe and sensible while this discussion is ongoing. But somewhere in the middle is almost always right. Hope you learned something today. If you did, please subscribe, share it with your friends, and I can't wait to see you next week.